Good morning. I understand. I think I'm a little loud and echoing, am I? Do I? I don't have the opera voice, so it's echoing from me anyhow. Good morning. I'm Jane Clark. I'm the Dean of the University of Maryland School of Public Health, and I thank you for joining us bright and early. I understand there is an accident on 29, which is causing a problem for our Baltimore colleagues. This is our fourth annual Public Health Research Day. And as is the tradition, it's in National Public Health Week, which President Obama recognized yesterday at the White House. So just so you know that this Public Health Week, we should all be healthy as a public. No. This event is designed to bring our students, our faculty, our community partners, and all to come together to advance research that informs and improves the public's health. It's sponsored by Empowering the State. This event is co-led by the University of Maryland School of Public Health and my right honorable colleagues, its department up at the School of Medicine at the University of Maryland, the Department of Epidemiology and Public Health. And Jay will bring some greetings in a few minutes. When we launched this event in 2013, our goal was to engage all the colleges and schools on both the College Park and Baltimore campuses to look at their ongoing research as it related to public health. This year, between our panels and our posters, we represent 8 schools between the 2 partnering campuses. From Baltimore, the School of Medicine, Nursing, Dentistry, and Pharmacy. And from our own campus, the School of Public Health, of course, the College of Computer, Mathematical, and Natural Sciences, the College of Education, and Behavioral and Social collaborations with other universities and with community organizations and governmental health agencies play an important role in this work as well, and we're pleased to have those partners attending today. Among the other universities, I love this, the other universities that are here, we have Johns Hopkins, Morgan State, the University of Minnesota, really? University of Michigan, Bowie State, and other contributors are George Mason, Marquette University, I'm sorry, no Villanova is here today, I'm sorry. But go Villanova. The Oregon State University, BRAC University from Bangladesh, the U.S. Naval Academy, the U.S. University of Health Services, or USES, are all here as well. So that shows you that this isn't just about the 2 campuses at College Park and in Baltimore, but also about the state of Maryland. Because remember, this is public health research at Maryland for all of us. And if Michigan and Minnesota want to join us, that's okay. Our theme this year is from community engagement to population health. To improve the population's health, it's essential that we have strong partnerships between academic institutions and communities that surround us. From their inception, we need collaborative engagement for our programs to be successful and, most importantly, sustainable. This year's program will feature nationally known public health figures as well as Maryland County and state leaders and experts that highlight the distinct features of Maryland's unique healthcare system and our opportunities to improve the public's health. We are pleased this morning, I'll just give you a little glimpse of what the program holds for you this morning. We're pleased to kick off this morning with a talk by Dean Schillinger, a professor of medicine and the founding director of the Center for Vulnerable Populations at the University of California, San Francisco. He brings an innovative and interdisciplinary approach to health literacy and health communication, and I think you'll enjoy learning about the bigger picture diabetes prevention campaign, which engages minority youth as agents of positive social change through their spoken word and performance art. This will be followed by Carolyn Miller, a senior program officer from the Robert Wood Johnson Foundation, who is a leader in measuring progress of the foundation's national initiative to create a culture of health and to redefine what is being healthy and staying healthy means in this country. I don't want you to miss the panel discussion on population science this morning, on population science and cancer prevention, that is co-led by Drs. Cheryl Holt and Joanne Dorgan. Dr. Holt is on our campus and Dr. Dorgan is in the Department of Epidemiology and Public Health at Baltimore. And they co-lead the University of Maryland's Greenbaum Cancer Center Population Science Program as they describe their work about establishing a cancer survivorship cohort. We're also here to learn about how the state of Maryland is expanding its Affordable Care Act, AKA you know what, to improve the population's health. I love it. No, does anyone know what the real name of Obamacare is, really? With this panel, there'll be state and health system innovators such as doctors Josh Sharfstein, David Mann, and Walter Ettinger. Nothing comes close to hearing from leaders who are close to local and community needs and actions than our panel that we've brought in 4 health department senior change agents, Dr. Diana Apney, Pamela Creechmer, Olivia Farrow, and Alma Alawalia, all are county health officers in Maryland. Don't miss during your lunch that we have poster sessions. 3/4 of them are actually led by or include students here and on the other campuses. This is in the Grand Ballroom down the hall. We also have today, backed by popular demand, networking tables, which brings people together on certain themes that you can talk about, meet other people that are here at the conference to talk about different topics. That runs from 12:15 to 1:30, and again, that's just across from here in the Prince George's room. Last but not least, I want to thank our sponsors, Empowering the State, thank you, Delta Omega, the Honorary Society in Public Health, the Commissioned Officers Association of the United States Public Health Service, and the Public Health Commission's Officers Foundation for the Advancement of Public Health. Attending today are Colonel Curry and John McLaughlin as the Deputy Executive Director. Other sponsors include Agilent. You'll notice that there's a sign back where you signed in. Agilent was a sponsor for and helped us purchase a small molecule exposome machine for doing research both here and in agriculture. Leidos, who supports fellowships for our students in the Department of Epidemiology and Biostatistics, and Cigna, who has been supporting the Center for Health Equity's hair cancer prevention program that runs in the barbershops. I can't end today without thanking the planning team. All the stuff that just sort of works seamlessly is because of Dr. Dashanka Kleiman, who will speak in introducing our speaker, and Dr. Wendy Lane from the School of Medicine's Epidemiology and Public Health Department. While many faculty and staff and students involved in the event planning are too numerous to list, but please, if you see some of them, give them a thank you. Most importantly, though, there's a particular person who's a grad student this is her 2nd year. She has this down, Jessica Greenbaum. I hope this is on tape. I don't think she's here. She's probably working at the other table. But, go back and listen to this, Mom. Jessica has been just wonderful in organizing this and keeping this running on time. I also like to give general thanks to all those participating in the program as presenters, as moderators, network table leads, poster judges, student volunteers, and our communications team, our facilities and logistics. I mean, really, it just doesn't get any better than that. I have a wonderful team in the School of Public Health, and after 4 years, they have this down pretty well, but still, it's a heavy lift, and I appreciate all that they do. Today, so usually what happens is at this point I turn this over to a number of our esteemed leaders, some who come from Baltimore. It turns out that Baltimore is doing its Middle States accreditation today, which gets all the deans and the president and everyone to be there. But today we are really honored to have our Vice President and Provost, Marianne Rankin, who has been a great supporter for the school and for our Empowering initiative. So, Dr. Rankin, please. Welcome our Provost.
Well, thank you, Jane. It's a real pleasure to be here. This is a wonderful event, and every year it gets better. Jane and the organizers are really to be credited with just putting together an amazing day. As I say, I've been so impressed each time. And it's a great pleasure to be able to be here at the beginning of it for once and to be the person that officially welcomes everyone. I wanted to recognize a few people that are here from the campus, although now that I'm looking around, I only see one that's on my list here. And that's Ken Gertz, who's sitting back here, Associate Vice President for Research Development. Ken, thank you for being here. Are there some, let's see, I think, oh, here we go. Eric Denna, who is our Vice President for Information Technology, is in the back row. I think it's really great of you to be here, Eric. Some of the deans who we expect to be here soon are Dean Bonnie Thornton-Dill, from the Dean of Arts and Humanities, and Dean Gregory Ball from Behavioral Science and Sociology. Also, I'm sure Pat O'Shea will be here later. He is Vice President for Research. And of course, our esteemed colleague, Jay Magaziner, who's Chair of Epidemiology and Public Health in the School of Medicine at UMB. Thank you, Jay. Here this morning from various government health agencies and nonprofit organizations, including the FDA, the EPA, HHS, health departments from Prince George's, Montgomery, Charles, Baltimore County, and the state of Maryland, the Children's Environmental Health Network, Maryland Dental Action Coalition, Capital Area Food Bank, and many others. So we really appreciate all the interest from these agencies and their people. You make us feel appreciated, relevant, and you definitely add to the day and the variation in topics and discussions. So thank you very much for being here. I wanted to mention a few of the big initiatives. You heard Jane mention a moment ago Empower. A couple of other big things are going on right now that I thought it would be good to just mention from the Provost perspective. This event showcases the importance of our wonderful partnership with UMB, which was begun in 2012 with the declaration by the legislature and the system of the Empower initiative to bring the two campuses closer together in research and academic programs. And it has been a tremendous success. We have launched probably more than 15, I counted last time 15, but now it's more than that, different programs, academic and research programs, a wide variety that have included a lot of different colleges on our campus and most of the colleges from the Baltimore campus in a variety of ways. But in a sense, this one is the one that's deepest, I would say, and has resulted in not a merger between the two programs in public health, but definitely some very important connections and collaborations. And of course, it took on a new form in the legislature this term with another initiative to bring the two institutions closer together in a strategic partnership. I think the bill is now on the governor's desk, so we'll see what he does. I think he's supposed to do something with it tomorrow, so we can watch and see. But in a sense, we're already at the point that bill kind of mandates and endorses, because we are already very close collaborators, and we are already deeply engaged in a very productive strategic partnership that I think has been beneficial for both campuses, but also definitely for the state of Maryland. I would also have to say we're very proud of our School of Public Health. It's been almost 10 years since its creation. It was just reaccredited, and this is no mean task to go through. I think it was not a surprise that it was reaccredited because it's doing extremely well, but nevertheless, it's still nice to get it over with and behind us. So congratulations to Jane and her staff and faculty for getting that done successfully. We are also a part now at the University of Maryland of the Big Ten, and you wouldn't think that was terribly relevant perhaps to today's activities, but in fact it is, because the Big Ten has an academic arm to it, which is really, I think, unique among these athletics organizations. It's called the Committee for Institutional Cooperation. Its name is about to change to something that's, I've forgotten what it is. Big Ten Academic, no, I'm sorry, I can't remember what the new name is going to be, but it's better than CIC. But anyway, the CIC was established at the time the Big Ten was established, so it's a very long-standing, and it's a cooperation on the academic side of all these major universities, Research One, AAU universities, to do a variety of different things. It's connections at every level of all these universities to share best practices, leverage their size for purchasing, share courses and programs for students and faculty. It's very powerful, very wonderful, but one of the things that the CIC does is occasionally sponsor major joint research collaboratives across the whole of the Big Ten. The latest one that they have undertaken is an initiative in health disparities. So with, in fact, a very nice grant from a private foundation, they expect to develop a proposal that will be taken to federal agencies for further funding and much greater funding to address health disparities across all of the states that the Big Ten universities represent. So we heard Michigan and Minnesota are here. This is very relevant, I think, actually. And it is being led by our own Dr. Stephen Thomas from the School of Public Health here. This is going to be a huge, major initiative for our country, I think, as well as our state. And I'm very proud that we're part of it. So again, today is just the beginning reflection of what we're going to learn and be involved in, I think, through this initiative. So I'm really excited about it. It's also, we are also the site of an amazing new initiative in climate change. We have our new Dean of Public Policy was actually most recently a major senior aide to the UN, and one of his most important roles at the UN while he was there was to focus the UN's attention on climate change and what it needed to be doing about it. He organized the Paris meeting on climate change last year, and the follow-on, Climate Action 2016, the follow-on to that Paris meeting where a lot of new policies were agreed to and so on. The action part of it is actually being held in just a few weeks here from May 4th to the 6th, downtown in DC and here on this campus. And a major piece of that is a focus on the topic of climate change and health. And our campuses are very involved in that. We will have a major forum on the 4th here on our campus before the remainder of the meeting moves downtown to DC. And some of the leaders from our campus and today's networking table on climate change and health, Drs. Amir Sakapta and Adel Shimahamadi will convene a day-long session on the 4th on adaptation and resilience as part of this summit on climate change and health. Or climate change, and this is one of the health pieces of it. So again, major things happening here that will, I think, have consequences far beyond our state and our campuses, but we're very proud to be a part of it, and I hope you will watch as all of these things evolve going forward. We're also very proud of the newly formed CONSERVE, C-O-N-S-E-R-V-E, which stands for the Center of Excellence for Sustainable Water Reuse, Food, and Health. I always am so impressed with people who can actually assemble a title for a program that spells something so sensible and relevant as CONSERVE. Anyway, this is a huge new initiative funded with $10 million in grants from the USDA and the National Institute for Food and Agriculture, led by Dr. Amy Sakopta in the School of Public Health. And this multidisciplinary team includes experts from across this campus, as well as Baltimore and the Eastern Shore campuses here in our state, as well as a variety of other partners in the Mid-Atlantic and in the Southwest. So this is another major initiative being led from our campuses. It's very exciting, and we're very proud of it. Where the university is committed to investing in new resources that support public health science and also new academic investments. These new research investments include, as Jane mentioned, the new small molecule exposome core facility housed in the School of Public Health, and we're very thankful to Agilent for that. This enables researchers to analyze environmental and human biological samples with high precision. And also the University of Maryland Census Research Data Center, which provides our campus researchers secure access to restricted data sets that allow them to address many questions that inform health policy. And it will also play a role in all this CIC initiative and so on. So we really are the center of a lot of opportunity here, I think, and a lot of activity. So I encourage you all to explore the diversity of research presented here today in the poster session, to network with other attendees, and please participate in and enjoy the more formal presentations here this morning. We welcome you. We are proud to have you here. We're proud of all that's going on here, and I hope you will enjoy the day. Thank you very much. I forgot to say, following me is Dr. Jane Magaziner, whom you've heard introduced twice, head of the Department of Epidemiology and Public Health and UMB.
Well, thank you. I also would like to bring you welcome. Thank you, Dr. Rankin and Dr. Clark, for your kind words, both of you. I'd like to welcome you from the University of Maryland, Baltimore campus. I'd also like to welcome our distinguished guests, whom I'm looking forward to hearing and learning more about the work that you're doing in community-based diabetes prevention and in building a culture of health, which I think is so important. I think in this room, it's probably a pretty familiar term, but I think, and the concept is probably pretty familiar, but I think when you walk outside of this room and you walk into the healthcare environment and you walk into communities and a much broader context, the whole notion of a culture of health is something that really needs to take place, and I like to think of it as a culture of public health as well. And that's really one of the goals that we have in bringing our public health efforts together, is really to create an embedded culture of public health that's part of the fabric of everything that people do, whether it's in business, whether it's in industry, whether it's in education, healthcare, and et cetera, in everything. I'd like to acknowledge the special efforts and the vision of my partner, Jane Clark, and before Jane, Dr. Robert Gold, where we started even before I knew who Jane was, thinking about how we can do something collaboratively that crosses the two campuses. And it's really quite heartening to me to see the kind of initiative and effort that's really come together to make this happen. And I think we're really still, I don't know if we're in the infancy or childhood phase, but we're really very early in our development, and I think there's a long way to go in establishing very healthy collaborations. I'm pleased to have this opportunity under the Empower the State initiative, which was a financial stimulus as well as a facilitative stimulus. It did more than provide dollars. It provided opportunities that exceeded well beyond the funding that was put into it to create a lot of opportunities for collaborative work. And Dr. Rankin and Dr. Jarrell, her counterpart in Baltimore, are to be thanked for their wisdom and willingness to help promote this effort. Our plans to bring these programs together in a collaborative manner has a lot of advantages for enhancing the public health workforce, for bringing together students and faculty from both campuses with the intent of developing new research collaborations. And with our strong education programs as catalysts, we hope that new research collaborations that benefit both campuses and the greater population, which are already taking off, will continue to thrive. And I think you'll hear some examples of that today. And in fact, one of the next panels is one very, very keen example where I believe that our efforts in bringing an infrastructure together have actually led to a specific program around cancer prevention and population health in cancer, which I don't believe would have had the same degree of takeoff had we not created the infrastructure, Jane and I, for people to begin meeting and talking about what they could do together. And I think that infrastructure that we've established has really been key to making more collaborative opportunities available. And as I looked over the program today, I was particularly heartened by the emphasis on improving health for the population through efforts in the community, through efforts in the healthcare systems, which you'll hear more about today, and public policy, and the tremendous efforts Maryland has made to redirect and reoriented its healthcare and preventive services programs, which you'll also hear more about. I think that the opportunity here in Maryland to change the way care is delivered, the way people think about care, and the way people turn attention to preventive efforts and public health efforts will be quite significant. I think we're also seeing that take off. So we have a lot of things in store today. And again, thank you all for coming. And I bring greetings from the campus of the University of Maryland, Baltimore.